Greetings, I'm Dr. Tom Gawel at Partners Animal Hospital NoDa. I have a very special guest here with me today, the amazing, illustrious Dr. Katie Gribb she's the ER service head at Skyline Veterinary Specialist here in Matthews, North Carolina. Welcome, Dr. Katie. Thank you so much for being here with us today.
Thanks, Dr. Gal. I appreciate you having me.
Absolutely, absolutely. So we're going to cover a very important topic. I think a lot of owners have questions about what's an urgent care versus an emergency hospital. Of course, Partners Animal Hospital NoDa, we're a general practice, full service, but there's times where our patients need advanced care. They may even need specialty care like cardiology, internal medicine, surgery. Dr. Katie's hospital is one of those few in the Charlotte area that we coordinate and we work together to get the best care available for these guys. So, keeping in line with that best care, there may be times where unfortunately our pets do need this emergency or urgent care. And we see it in human medicine. We have hospitals with emergency services, but then we have these standalone buildings that are urgent care, right? So again, how do we determine what we need to go and where we need to go if it's middle of the night or after hours or another time? So I guess let's dive right into it. Dr. Katie, tell me,
Great, yeah.
what are signs and symptoms of like urgent care, and how soon should we get these guys to the vet?
Absolutely. So I think first and foremost, again, thanks for having me. And your hospital is somebody that we love working with. Two, what I always think about how difficult it is to ask pet owners to decipher between an urgent issue versus an emergent issue. And even in the human world, we have a hard time deciphering that. And when in emotional and stressful times, that makes it even more difficult to determine where you need to go. And you now have all of these options available from your general practice. And you are so wonderful about taking in urgent issues into your general practice. And now you have all these urgent cares popping up as well as emergency hospitals. So that's where we're here today, to try to decipher between where you really need to go and who you need to ask for help. And so first and foremost, I always think about emergency care. The best way to think about that is it's for any life-threatening illness or injury that requires immediate attention, treatment, or hospitalization. And so those things that first come to mind, of course, is anything that like choking, respiratory distress issues, active seizures, fractures, anything traumatic, God forbid that ever happens to your fur babies, any falling from high areas, hit by cars. Unfortunately, those happen more than we like to see. Heat stroke, severe allergic reactions where there's a lot of facial swelling that can lead to trouble breathing, penetrating wounds, so wounds that are very extensive or where there's actual penetrating material going into different areas of the body. And that's probably the majority that I can think of off the top of my head. Of course, there's more to be listed, but if any of those things that you see or are worried about with your pet, going to a 24-hour emergency facility is the first thing that I would recommend. And I would go straight there and make a phone call on the way. I would not wait by any means. Right. Now, if you're unsure, if that is not what your pet is experiencing, those distresses, then I would look further into considering an urgent care. And so if you need guidance on where to go, I think first and foremost is contacting your general practitioner, because you should have an established relationship with a really great general practitioner, such as you, Dr. Gal, because you build relationships over several years and you know these pets best. You know these dogs and cats best. We see through ER and urgent care a snapshot in time of these pets. And so oftentimes your team's already trained as to alerting the pet owner as to, can they come into you? Do you guys have availabilities to see this, or do you have the means to be able to care for this? Oftentimes if hospitalization is required, that's not always the best first choice. And so they can then make the guidance or guide that pet owner to then contact or go directly to an ER or an urgent care. Again, urgent care and ER can be difficult to decipher between. So if you have somebody like a good team member that knows your pet best and knows you best, they're going to help you through that situation. You can also always contact an urgent care directly via phone. So if you feel like your pet is not in so much distress that you have a few minutes to make that phone call, you just give a call to the closest, nearest and dearest urgent care around you. And luckily we have so many means to be able to search these places on the internet now, and word of mouth, of course, too, or recommendations from your general practitioner. So when I think of urgent care issues that we need to deal with, I think more of things like something's wrong with my dog or cat. I'm really worried about them and I feel like they need to be evaluated as soon as possible.
Right.
Do I feel like this is something where we need to be rushing in an ambulance like you would in the human world to an ER? No, but I still don't think this is something that can be wait to be seen if my general practitioner is booked out for a few days. So it tends to be things that need to be seen within about a 24-hour time period or so. I think of things like bite wounds, dog fights at the local dog park, acute or recent vomiting and diarrhea, constipation issues, not being able to defecate, things like ear infections, skin issues, itchy skin, rashes of the skin, limping or lameness, nail issues, broken nails, overgrown toenails, smaller cuts or abrasions, coughing, sneezing, nasal discharge, runny noses, nasty worms that they see in the poop, maybe that pop out that freak people out from time to time, never fun to see. Fleas or ticks that they notice on the skin, and even extending as far as like any blood in your pet's urine or straining to urinate in the litter box, things like that. Those are more urgent issues, including too, if your pet ingested a known toxin, ate a plant that you're concerned about, anything like chocolate ingestion or rat poisons, grapes, raisins, and dogs, things like that. If you know that they ingested those things, you can get them to an urgent care where we can start to move along with treatment and getting that baby seen and treated quicker. So I hope that helps.
Absolutely. All good tips. Definitely. At Partners Animal Hospital, we have procedures, protocols in where if somebody calls for an urgent care visit or it seems like they're having an emergency, that's our priority. We want to get our patients in, whether that's an appointment, it's a work-in appointment, sometimes drop off. Obviously, if it's an emergency, a life-threatening situation, like you mentioned, you're going to move to the top. That's your priority one. So I think these are all wonderful tips. I appreciate you coming on here today to go through what's an emergency, what's urgent care. And again, love seeing you, love talking to you, but if pets can avoid talking to you, maybe that's for the best.
Exactly, right? Though, exactly what I always say too. We're here to help anytime you need us, but hopefully we never have to meet each other.
Right. Absolutely. Thank you so much, Dr. Katie. And hopefully we'll run into each other in the same circles again soon, but appreciate your time today.
Oh, you too. Thank you, Dr. Gawel.
Bye now.